everyone, I am Eva Lakshmi from Rebana Institution. I am studying 10th standard. Before going into the topic, I want to share a real incident. There was a guy, he was my neighborhood, and he was very sick. He was very sick. His parents took him to the hospital. So his parents took him to the hospital. Then the doctor declared that he was suffering from leukemia. So what is leukemia? Leukemia is a type of cancer found in the blood and bone marrow caused by the too many white blood cells in the body. The white blood cells don't let the body fight disease and prevent the body making red blood cells. So then the doctor gave a treatment, that is chemotherapy. Chemotherapy is a type of cancer treatment that use only or more anti-cancer drugs. Chemotherapy may be given with a corrective intent, or it may aim to prolong life or to reduce symptoms. So chemotherapy is a painful treatment. So friends, say me, is there any painless treatment? So this chemotherapy was troubled a lot by the boy. So there is any painful treatment? Yes, there is a painful treatment, that is none other than stem cell therapy. Stem cell therapy. Stem cell therapy is also called as a bone marrow transplantation. It is a treatment for the types of cancer. Chemotherapy is a painless treatment, that it's okay. So it is really promising. So now we can say, today my topic is stem cell treatment really promising? So objectives, uses of stem cells and stem cell therapy. Diseases that stem cells can rectify. Potential use of stem cells. Advantages and disadvantages of stem cells. So before going into the topic, we want to know what are the stem cells. Stem cells are the body's raw material cells from which all other cells with specialized function are generated. Under right condition in the body or a laboratory, the stem cells divided to form more cells is called daughter cells. These daughter cells either become new stem cells or specialized cells with specific function, and no other cells has natural ability to generate. Stem cells are mainly foundation cells for every organ, tissue and cell, and stem cells are basically a force of nature that is responsibility for healing of wound, organ growth and repair. The first stem cells originates within the developing embryo. The types of stem cells. There are the 4 types of stem cells. They are cord blood, embryonic stem cells, bone marrow stem cells and adult stem cells. Embryonic stem cells to be used to generate or repair diseased tissue and organs. Adult stem cells may be able to create various types of cells. Bone marrow stem cells may be able to create bone or heart muscle cells. Cord blood stem cells can be used to treat hematophagic and genetic disorder. So now, who introduces the stem cells? We must know their names, isn't it? So the stem cells are introduced by James Still and Ernst Macaulay. The key property of the stem cells were first defined most Ernst Macaulay and James Still in the early 1960. They discovered blood-forming stem cells, the hematophagic stem cells, through their pioneering work in mice. So, previously we have learned what are stem cells. Now, we are going to learn what is a stem cell therapy. Stem cell therapy has been a revolutionary finding in the field of medicine. It is most promising way treatment and the amount of within very minimal amount of risk. Stem cell therapy are the use of stem cells to treat or prevent a disease or a condition. Bone marrow transplantation are widely used in the stem cell therapy but some therapies are derived from the umbilical cord blood cells are in the use. So now we know that stem cells are introduced by Macaulay and Gemstill. Now, who introduced the stem cell therapy? In the stem cell therapy was introduced by Martin Evans and Gail Martin introduced the stem cells therapy in the year of 1981. They conducted separate studies and derived pluripotent stem cells from the embryos of mice. These early cells are the first embryonic stem cells ever to be isolated. Now, here is a study on what kind of disease the stem cells take care of and what way it is proving lifesaver therapy for the people all around the world. Spinal cord injury. Spinal cord injury can be really very bad, and if it is severe, it can paralyze one's life. The stem cell therapy has shown light to people who are suffering a lot due to such kind of injury. The stem cells, in some cases, the therapies like stem cells are helping paralyzed victim regaining some feelings in control over their lower extremities. Now I am going to talk about diabetes. Many of the people around the world are dealing with the problem diabetes, type 1 diabetes. In this disorder, the insulin making pancreatic cells to being killed by the immune system of their body. So, with the introduction of the stem cells is become very possible, and this have proved on the mice, but human testing part is still remaining. Now, I am going to talk about heart disease. This is another major factor of human fatality, and the stem cell therapy can inject in their body. If injecting their body, it can be regenerate or heart muscle damage it caused by the heart attack. Now I am going to talk about Parkinson's stem cell disease. Parkinson's disease. Embryonic stem cells can give rise to the dopamine making neuron that the people having the disease lack. Now I am going to talk about Alzheimer's disease. The embryonic stem cells are very much helpful in treatment of Alzheimer's. This disease causes memory loss, cognitive decline and behavioral problem. So, this treatment have been shown light to people, and by some experts believe that this disease might cure completely. Now, I am going to talk about arthritis. Arthritis is a disease, it is the most bothering disease when osteoarthritis are the common form in the arthritis. This was the most bothering disease that troubled the people all around the world. So, these stem cells give rise to the new treatment, and these stem cells it results when the protective cartilage are wasted away. This treatment this stem cell therapy can protect the lost cartilage and repair the short joints. This is the disease that stem cell can rectify. Now I am going to talk about potential use of stem cells. There are the huge type of stem cells are present, but currently the potential use of stem cells are umbilical cord blood cell and bone marrow transplantation. So, umbilical cord blood cells are found in the stem cells of the blood. It is hematopoietic. This is the another measure of the factor that can be proved 100% results, and these stem cells can cure the disease like leukemia and cerebral palsy. And the treatment of cerebral palsy with cord blood. High risk placenta. Collecting cord blood cells immediately after birth. Freezing and storing. When cerebral palsy is confirmed 6 to 12 months after birth. And cord blood transfusion and high risk to the infants born around 33rd week of pregnancy. These are the treating cerebral palsy with cord blood cells. Now, Advantages of bone marrow protherapy. So our own stem cells are used to treat pain and sport injury. Great alternative to surgery for athletes and the people with chronic pain. Bone marrow is easily accessible. It takes minimum amount of the time. It is a painless procedure. Now, disadvantages of stem cells. The same stem cells treatment is likely to work different disease for different condition. The science behind a disease should be matched science behind the treatment. Now, I want to say an example. There is a middle-aged woman in the US. She want to use facelift. Then the stem cells are injected around her eyes. So what happened? After a few weeks later, when she blinks, she had a click sound. So what may happen there? There is nothing but the stem cells are turned into bone. So, and now she is get surgical removed. That's what cells from your own body are not automatically the when used to treatments. When used to treatment. Patient testimonials, other marketing provided by clinics and may be misleading. The experimental treatment affords for sale is not same and clinical trials. Now, what friends, before we have learnt what are stem cells, stem cell treatment and how we can rectify those disease and effects and is stem cells are really, many stem cells are really promising. So, those are we have learnt. So, now I want to say that is stem cells are treatment really promising? So, stem cell researchers are making great advance in understanding normal development and figuring out what goes wrong with the disease and testing the potential use of stem cells. So, the list of the disease has shown stem cell treatment has shown the beneficial still very short. And best defined and most extensively are used the bone marrow protherapy and umbilical cord blood cell. There are the potential evident to as shown to the people saved the thousand of people with the thousand of children with leukemia. There are the potential. So the beneficial of this treatment is huge, but currently few stem cell treatment are proved safe and effective. Food and Drug Administrative Service are being approved just only bone marrow protherapy and umbilical cord blood cells. So these have proved on the to be cured the disease. So umbilical cord. You may ask the question where we have to store. And there is many of the banks are there. Many are the banks are present in our India or in our world, and we have the banks to store our blood cells. Their cost may be 2000, but it save your lifetime. But we can't use the embryonic stem cells because of it destroy. Why we can't use the embryonic stem cells? Because the embryonic stem cells can destroy the embryos. So that may cause it by lost the life. That's what we are not using the embryonic stem cells. And now we may use the bone marrow protherapy for the cure. So if my decision what means, if we take is stem cells is treatment really promising? So it is promising, but how it wouldn't be cure that 100% safe and effective. And for example, I get the malaria fever. I don't want to take the treatment as any other dengue or the other diseases, isn't it? I want to take just my treatment what malaria. I want to take my disease what malaria. I want to take the treatment of malaria treatment only. I don't want to take all these things. So the researchers are being to said that it is most safe and effective, and the stem cell therapy is also we know that the stem cell therapies are known as the regenerative medicine, which promotes the repair and response in the diseased or injured tissue. Using stem cells or their derivatives, researchers still have much to learn about how stem cells work in their body and capacity for healing. Safe and effective treatment for most disease and condition and injuries are in the future. And finally, I want to say that science behind a disease should be match the science behind the treatment. That is the main conclusion of myself. Thank you. Now I want to show that what are the objectives. So friends, what we have learned, what are stem cells, what are stem cell therapy, how to rectify our diseases, and umbilical cord blood stem cells are in a use, and how many types are currently established to safe and effective, and what way we are treating it is a good for our health. We want to approve those, and now so the potential use of stem cells are the many use, but the currently established stem cells just only what friends? They are bone marrow transplantation and umbilical cord blood cells. But we don't want to use embryonic stem cells here, but in India there are adult stem cells are using in India for safe and effective. First it was implemented by the Mumbai, and it was very important to cure. Please friends, say to your neighbors to store your umbilical cord blood, and may cure the disease. When you develop your disease, it may cure. You don't think it is costly, but it cures your life for effective and great. So I don't want to, no one should, all must be store the stem cells and whole things for in your future if you are developing all those things. So if your causes leukemia, you want to cure the disease, so go for your treatment as a cord blood stem cells or any others. And now, so introduction of the stem cells. Who are they? James Still and Ernst Macaulay are the introduced the stem cells. And now who introduced the stem cell therapy? Stem cell therapy was introduced by the Martin Evans and Gail Martin. In the year of 1986, the umbilical cord is currently established. So that stem cells might cure the disease completely. So this heart disease and spinal cord injury can be not proved. It was proved on the mice, but we couldn't use embryonic stem cells. I said Alzheimer's disease very much helpful in the embryonic stem cells are very much helpful in the treatment of Alzheimer's disease. But we don't want to use Alzheimer's disease. We don't want to use the embryonic stem cells. If we want to use the embryonic stem cells, it can destroy the disease, like destroys the embryos, and these embryos can be destroy the life of human beings. That's what we don't want to use. But it was proved, all those are proved on the mice, but we couldn't want to use. Which are the safe and effective, we just want to use. So that I want to say that the stem cells, the many researchers wanted to conduct all those things. Thank you.